Hi, everybody. I'm Jessica Lamb. I'm so sorry I could not be there in person today. I am 54 years of age as of yesterday. I am a trans woman, and I would like to talk to you a little bit today about transgender elder wellness. I'm going to talk a little bit about some medical concerns and about mental health, fears about aging, a little bit about discrimination, maybe talk a little bit about advanced care planning. These are all things that of course, I'll have to worry about as I age here in the system. Some of the challenges, really, for the gender diverse community is that there are many disparities in areas such as quality of health and access to healthcare services, mental health care, employment, housing, other areas of livelihood. Basically, a lot of research reveals that many transgender elders routinely encounter both a healthcare system and a national aging network that are ill prepared to provide culturally competent care and services, and creating residential environments that affirm gender identities and expressions of course, this aging transgender population. And now more than ever, we've got kids who are transitioning younger in age, so they're going to be growing into this system. And again, we're not really quite prepared for these. Some of the overview on what we are concerned about essentially are areas of physical health and of mental health. So let's talk really quickly about some of those things. So basically, when I talk about physical health, it's really important for you to know that we are talking about considerations based on anatomy, regardless of gender expression. So when we're talking about age appropriate screening for cervical and breast cancers, screening for HIV, AIDS, and STIs, cardiovascular disease, age appropriate screening for prostate ovarian cancer, age appropriate vaccinations, all these things again are going with the natal sex of that person. I know many trans people don't want to hear that, but it is important to understand that in order to have proper health care, you do have to have these things done. Trans men are at risk for cervical cancer. Cervical cancer is the third most common cancer globally. So typically, many trans men are less likely to be current on cervical cancer because, of course, they want nothing to do with that part of their anatomy anymore. So individuals who have never been screened or tested are at higher risk of like chronic HR, HPV infection, and things of that nature. So it's really important that they go get a pap smear. Trans women, of course, do not need a pap smear because they don't have a uterus. And it differs from non-transgender women in the length of exposure to estrogen. So when we're talking about breast cancers, it's recommended that screening for trans women happens after about 5 years of feminizing hormone use, regardless of whatever age they are. However, it's recommended that the screening be performed every 2 years once you hit the age of 50. So that means it's time for me to head to the doctor to have a screening. But yeah, that's really important. Cardiovascular disease, again, is based on your medical history and your natal sex. Many trans identified individuals don't go to doctors regularly, so they don't check themselves for things. And many, just don't really pay attention. Same thing about, prostate and ovarian cancer. What's really funny as a trans woman myself, I have a prostate. I'm post surgical. I had surgery in 2003, so I have a neo vagina at this point, but I still have a prostate, which means, you know, it's something I'm going to have to get checked. So imagine a trans woman walking into a urologist's office and saying, "Hey, doc, I need a prostate exam," and them looking at us like we're crazy. So, but it is important to check, especially if there's a history of prostate cancer in their lives. Listen, just because you're having these tests, it's about health. So it's not necessarily about your gender; it's about keeping you healthy. So, screening for HIV, AIDS, and STIs. Well, we're looking at the general guidelines as given to us by the CDC. There's a higher risk for the trans community due to the intersecting discrimination and high rates of trauma, unstable housing, poverty, incarceration, unemployment. These all negatively impact HIV risk. So the CDC guidelines recommend that screenings for these, including trans men and women, as special populations, and they recommend risk assessment based on the current anatomy and sexual behaviors and awareness of symptoms consistent with common STIs and screening for asymptomatic STIs. So essentially, recommendations for management of this doesn't differ for non-transgender people, and based on risk, with screening every 3 months in individuals that are at high risk. So there are populations of trans individuals that are at high risk. So age-appropriate vaccinations really important, especially after the pandemic. When we had to get the injections for vaccination against the virus, the coronavirus. So same thing goes for all the other HPV and all these other vaccinations that would be appropriate for regardless of your gender identity. Some additional health concerns to be thinking about: diabetes, bone health, and osteoporosis. Trans women in particular are at high risk of this because of the estrogen intake that we take, because it lowers muscle mass and lowers level of vitamin D. Trans men, however, have a decreased risk factor to this because testosterone has the opposite effect and such. So, as a general rule, transgender patients are encouraged to enroll themselves in screening programs suited to their uh, physiological sex rather than their preferred gender. So it's hard to hear, which might cause some mental health concerns. It's important to note that mental health concerns should not be automatically assumed to be related to gender identity. So growing old as transgender is stressful. So some of these areas here are things that we want to pay attention to. Depression. Aging can be emotionally, physically, and financially challenging for anybody, essentially. But transgender elders face extra, heart-wrenching questions in the last chapter of their lives. So, number one, they're estranged. Many of them are estranged from their families. And with a lack of potential caregivers, this is a big concern. Some are isolated from the broader trans community because essentially the older generation's goal was to pass as cisgender. So, someone whose sense of gender conforms with the biological sex. So, in many, they fear facing death without their family or friends or support because many of them have gone stealth. They are some transgender patients who most mistakenly attribute psychological problems to hormones, right? We blame it on the hormones all the time, but most of the time, their problems have nothing to do with these hormones. So it's important to note that because of increased isolation among elders, there's a major risk of depression there. Generalized anxiety disorder. As a trans person ages, they can become overly concerned about health issues, money, family problems, possible disaster, especially through the pandemic that we had in 2020. Those with what we call GAD usually understand that they worry more than necessary. Older trans adults with this have difficulty relaxing, sleeping, concentrating. They startle easily. Transgender people, particularly trans males, according to some of the studies I saw, have higher levels of anxiety symptoms suggested of possible anxiety disorders compared to the general population. So, understanding these different factors may offer opportunities for targeting clinical and structural interventions. Bipolar disorder. The clinical assessment of the older trans adult with bipolar disorder requires careful consideration. Older trans adults presenting with, these sort of symptoms comprise of two clinically significant subgroups: those with early onset bipolar disorder and those with late onset bipolar disorder. Older adults with bipolar disorder are at increased risk for functional decline and overall morbidity and mortality. Anyhow, use of standardized tools for evaluating these symptoms is important. So, these are all things we want to consider. Suicidal tendencies. Studies show the prevalence of suicidal thoughts and attempts among transgender adults is usually higher than that of the average U.S. general population. So, these suicidal ideations are linked to essentially more loneliness, depression, and hopelessness. The cumulative effects of experiencing multiple minority stressors. This is like family rejection, discrimination experiences, lack of access to gender affirming healthcare. And, this is a startling statistic here. And this is a recent statistic among the transgender elderly. 48%, this is half of the population, report symptoms of depression, and 71%. So think about that as like 3 out of 4 report a history of suicidal ideation. So these are all things we have to consider. Anxiety about needing care. Geez, many care homes are not prepared to take in, this population. And it's the first time really in history that we're seeing the rising numbers of this community entering into this care. The rise in transgender people entering care homes poses a new set of challenges for care providers, as trans people essentially have very specific needs that need to be addressed. Transphobia is very much alive, and there are many examples of serious neglect where trans people have not been cared for. Here's a photo of a trans woman here who basically, quoted here, "I'm already scared of death, as many of us are. I don't want to die. But being a transsexual, I worry I will die thanks to some bigoted doctor or something bad will happen to me and they will let me die because I'm transsexual." So these are some of the anxieties that we fear, as we get older. Those are some of the medical concerns and mental health issues that we're dealing with. Um, the fears about aging, this is a hidden population. So there's a recent study by the UCLA Williams Institute that found that there's like a zero point 0.5, which is basically 1 in every 200 of Americans age 65 or older identify as transgender, compared to 0.7% among 13 to 24-year-olds. So you're seeing a higher number of younger people coming out and who are aging into the system. Older people's experiences often are profoundly different from those of today's transgender youth. Many of those, issues we have had is, based on the state of lawmaking. It is not new that, there are laws that are keeping us from getting health care. I mean, when the 1980s, when I was growing up, we had Anita Bryant, who essentially was trying to eradicate the gay community. And the trans people were included in there as well. So we were a very invisible population. The hope I have today is that we didn't have a community back then in the 80s and 90s. It just didn't exist. We were all in the closet, most of us, but we have a huge and thriving and loud community today that are really just, doing their best to try to um, be authentic to themselves. So some of the strategies we want to try to impose, to creating a welcome environment for our gender diverse population. So if you are working with somebody who is gender diverse, share some personal history about yourself before you inquire into the social history of your patient. Create that small talk, so that you kind of set their minds at ease and they don't feel as nervous sharing with you. Are you an ally? Are you not an ally? Are you wearing a little pin on your shirt that says, "Hey, it's safe to come and talk to me"? These are all things. You can join referral programs, adapt forms if you are in charge of putting together forms at your place. You want to have these forms be inclusive. So instead of saying, a husband and wife, you can say a spouse or partner, right? So, have different forms be more inclusive. Talk with your registration staff and clinic director. So, you have a front line. These are the receptionists and these are the office managers. These are the people, who may, see these individuals, and you want them to be aware of how to work and how to address them. Sometimes using the proper pronouns will save a life. And by not using a proper pronoun maybe means that, this person may not end up getting the health care that they need. So, think about always using their preferred pronouns. I mean, it's not hard. I mean, it's doing no harm to anybody just for using a pronoun, even if you don't agree to it. Encourage cultural competency again with your colleagues and staff. And of course, place like little friendly LGBTQ plus IA symbols. We're going to take over the whole alphabet soon. But put it in a visible location. Is there a sign in your office? Is there, some way of indicating that you are a safe space for the gender diverse community? Of course, we're looking for that. We want to see that this is a good place and have an open dialogue, and talk about life circumstances and such, and encourage them to get the right possible help. So I'm not there for me to answer any of your questions. So I'm kind of covering what you need to. Something that, we also need to talk to our gender diverse population who are getting older is advanced care planning. We need to talk about next of kin status. Who's going to be there if you had to go under? Do you have a do not resuscitate? Do you have, these things, living with a will, healthcare proxy, and I'm talking about these things, and I'm not just talking about to the gender diverse community. I'm talking about everybody. Most of us, don't even have a living will. or a healthcare proxy in place. Wills and estates, what happens. So all these things are things that we need to consider. But I hope that my presentation was helpful. Again, I'm sorry I couldn't be there today. But of course, if you ever want to reach me so that we can discuss these things, I'm happy to be available to you. So just ask Cindy Brown for my information. She'll pass it along, and I'll be happy to talk to you about it. And if you were interested in a presentation like this for your organization, I'm always available as well. So thanks so much. Bless you all. I hope all is well, and I will head back to my event. So see you later. Bye, everyone.